everyone, I'm Navya. I'm centered for Nirvaana Center. I'm here with Dr. Manoj Kumar, consultant psychiatrist. With the exams approaching, many parents have been reaching out us with the concerns about stress, pressure, and emotional changes in their children. Today we are going to address some of these common OPD questions and help parents to understand how to support their child during this time.
Sure.
How can a parent differentiate between normal exam nervousness and clinical significant exam stress?
Okay, it's a good question.
Okay.
You are asking a very basic question, whether it is a nervousness or it is some kind of disorders. Usually, before the day of examination, child may show little bit of sleep disturbance, may show mild worry regarding the exam about the performance. Usually, this kind of stress is good for performance. But the other question, like whether it is clinically significant anxiety, in which the child will show more worry for more than a week before the examinations. His or her sleep will be disturbed, may show the signs of irritability, anger outburst, or may have an episode of panic attacks. When you notice these symptoms, these are just more than nervousness.
Okay. So coming to the next question, how do we know if our expectations are motivating our child or unintentionally creating pressure?
Before answering this question, you should ask yourself some questions. Okay, does my child able to communicate and express his poor performance with me? Am I just praising my child for his efforts or only for the results? Okay, am I comparing my child with everyone in the neighborhood or relatives or someone like that? Okay, usually motivation feels like an encouragement, but pressure feels like a fear of disappointing you. Child may not express it. They express in their behavior like they have a tough time around you and hiding the results and executing perfectionism. So these are the questions you have to ask yourself.
So coming to the next question, what are the healthy ways to encourage academic performance without increasing anxiety?
Okay, you should focus on efforts, okay, not on the marks. And you should normalize the mistakes, accept the mistakes. You should break the task into smaller, achievable tasks. Okay, remember, you are the one who set the climate at the home, so you have way to solve it.
How can we identify when study hours are becoming excessive or counterproductive?
Okay, you should keep one thing in the mind, that more study hours is not equivalent to better performance. What are the warning signs of you are studying more but you couldn't able to succeed? Okay, so like a child is studying 6 to 8 hours without gaps, but it doesn't reflect in the results. Okay, making more mistakes, declining ranks, with the study hours being increasing more and more. Okay. So and poor sleep pattern. These are the things which is a counterproductive of your exam stress or studying more. Okay. Usually I would suggest to have a good sleeping hours in the night, at least minimum 6 to 7 hours. Can schedule a session of 6 to 7 hours of study with frequent breaks, frequent hydration, and frequent own times. Okay, this way you can promote better sleeping, better studying to the child.
So the next question is it advisable to limit extracurricular activities during exam periods or can they help to reduce in stress?
Not necessarily. Okay, usually stress produces a hormone called cortisol. Usually the physical activity will reduce the level of cortisol hormone, which will help in better performance, which will make them relax. So maybe limiting the physical activity, like what you do usually, like music, art, playing football, cricket, whatever he likes. Okay. So limiting can help, but not absolutely cutting it off.
What practical strategies can parents use to help the children improve time management during exam?
You should sit with your child, okay, and have a realistic timetable. what works for him, what does not work for him, and promote a difficult subject or difficult topic when the child have lot of concentrations. Okay, so and usually take a week off, okay, from study when you are studying exam, when you are preparing for the examination, and the ultimate strategy is to start early. This will eventually decrease the pressure from the child.
So coming to the next question, how can families create a calm and emotional supportive home environment during exam season?
You should reduce your family conflicts during the examinations, and you should maintain a strict regular meal and sleep pattern routines and everything. And you should start speaking more about efforts, not about the results. You should avoid the terms like this exam will decide your future, this will decide your lifestyle and everything. Okay, you should give the child reassurance. Your healthy mind is much more important than the examinations. You should remember one thing, that the child observe the parental anxiety.
Why do some children experience physical symptoms like headaches, stomach aches, or nausea before exams?
So usually, as we discussed before, anxiety increases the hormone cortisol. Okay, it usually creates a fight or flight responses. As you ask question like headache, why stomach ache? Okay, so when the anxiety increases, it creates a muscle pain, muscle tension, which will look like a headache.
Okay.
It makes the gut sensitive. So vomiting, stomach pain can happen. It will increase the heart rate, which leads to the palpitation. Sometimes it will increase the respiratory rate, may cause dizziness. So these are not child's trauma to escape from the exam. This is a bodily response to the child's mind.
So doctor, here we go, the most asked question.
Okay.
When the exam stress becomes overwhelming for both the child and the parent, when should professional help to be considered, and what kind of support is available?
So you should consider seeking a mental health support when this symptom persisted even after the examination. You could see change in behavior wise, any kind of depressive symptoms like hopelessness, self-harming thoughts, major decline in studies. This is the time you should seek for professional help. So supports may include evaluation by a psychiatrist or a certified mental health professional. Maybe there may be need of medications for the short term. You should remember that early intervention prevents long-term difficulties.
So doctor, we have covered almost all the questions.
Okay.
So would you like to tell any message to your parents?
I would like to tell the parents that the exam is only the measure of knowledge. It will not decide child's future or child's intelligence. So child doesn't need a perfect parent. They need a safe parent. If you can able to create those situations, create an environment in the home, a child can perform near to its total potential. I would like to give some tips to the child who is going to attend the examination. Before the day of examination, sleep better, hydrate yourself better, eat better, engage in some physical activities. Okay, don't overstudy, study and revise the things which you have already completed. Don't panic in the examination. Keep your mind very calm during examinations.
I think we have covered almost all the questions. Thank you for your wonderful time, doctor.
Thank you.
Please reach out to us for any further queries. Thank you.
All the best, children, for your examination. Thank you.